Well, Ms. Samuel, I've looked through your record at your previous allergy tests, and with your exam, I really don't believe you have a bacterial infection of your sinuses.
I see.
I think what's happening is your springtime allergy, the tree pollen counts are going up, coupled with a viral infection, is what's causing that facial pressure, congestion, and drainage that's bothering you.
Oh.
And the important point there is we need to treat the symptoms, but viruses can't be treated with antibiotics, so what we're going to have to address is the congestion and the mucus and the other symptoms that you're experiencing so that you will feel better.
Okay.
So are you comfortable with approaching this without an antibiotic?
Well, I've got to tell you, I have a really big presentation on Friday. And I just can't have all this pressure in my face and my nose, and I can't be coughing during it. So the last time I went to the doctor, he gave me an antibiotic, and it made it better almost right away. What do you think? Do you think that any other way will make me be able to have my presentation on Friday?
I know you're concerned, and I know the pressures of life and work do bear upon us. But I did think it's important to understand I don't want treatment that's not appropriate for your condition. And I think if we follow this plan, it will work without the antibiotic. And furthermore, there's a lot of side effects from antibiotics. They're not just medications to try for symptoms that we don't know what's causing it. Actually, up to 1 in 4 people who take an antibiotic have some type of side effect.
Oh.
Sometimes diarrhea, sometimes rash, yeast infections. And it also affects your family, your children, your grandchildren, your spouse, because their resistance of bacteria go up the more we use antibiotics.
I didn't know that.
So there's value in maybe thinking about this and maybe holding off. And I do think we can help your symptoms with a little bit of nasal spray with a corticosteroid to help suppress the allergy, and some maybe salt water to irrigate the mucus, maybe a little bit of pseudoephedrine since your blood pressure is fine. I think you'll be feeling better.
As long as I'm better by Friday morning, I'll be all right with that. As long as you're absolutely sure that'll work.
Boy, my mother does think I'm a brilliant physician, but I can't predict the future, and I do acknowledge that I can't guarantee you'll be better by Friday. But I'm certainly hopeful, and I will be available if things do not transpire as we've said. And I would also encourage you to look at this website and this material I printed from it, from Consumer Reports, that talk about some of the problems with antibiotic use and what happens when we overuse them. And just give it some thought, and I think it may not make you feel better right away, but I think it'll help you know that we're doing the right thing. So
Okay.
Are you okay with that plan?
If you're confident in it, then I'll be confident in it too.
Well, I'm confident we're doing the right thing. So let's hang in there together and see if we can't get through this.
Okay, well, thank you very much.